Turn it on. Okay. Okay. Sound check. Testing. Testing. 1, 2, 3. Can you hear me? How about the people on the internet? Is everybody okay with sound and voice? Okay. Okay. We'll go ahead and get started. I think Donna was having a little trouble accessing the internet. She's working from home today. Anyhow, we have a lot of slides. We have, in fact, over 120 slides. So we'll go ahead and get started. My focus today is to give you as much information as I can on how the coronavirus, COVID-19, is currently treated in China with TCM. And what I'll do is I'll briefly go over the Western medicine part and spend most of the time on the TCM part. Okay, so maybe about 10 minutes and 15 minutes or so, because I think the TCM part is what we are most interested in. Everything else, there is really a lot of information online. Okay, and this page also have all the people that have contributed to the articles, to the PowerPoint, and to everything else we have done regarding this subject. So once again, I want to give them a special thanks to each and every one of those individuals. All right. So very quickly, the background on the coronavirus, or in this case, the SARS-CoV, is that this is an RNA virus. Okay, and there are quite a few different strains of the coronavirus. The two that I think are most important for today's discussion is, number one, is the original SARS-CoV, which causes the SARS. And now we have COVID-19, of course. And COVID-19 is a disease, and the virus that causes it is termed SARS-CoV-2. Okay, and the reason this is important is because these two strains of virus are about 96% identical. So what that means is the COVID that we're dealing with right now is a novel coronavirus. So we are all going through a little bit of trial and error, trying to find out what is the most effective way to treat it. And because these two strains of virus are very similar to each other, the best places to start is whatever that works the best for the original SARS coronavirus. There is a best chance that they should work for the new strain, for the novel coronavirus. So that has been the approach of how most of the drug companies and also the herb companies and TCM as a whole basically start. So that's the place where we begin. And as we go through the next hour, I'll show you where we are at this moment in time. Okay. Quick general information on the clinical manifestation. Obviously, the incubation period generally ranges from 2 to 14 days. Sometimes a little bit shorter, sometimes a little bit longer, but the average is about 4 to 5 days. The general respiratory signs and symptoms include fever, dry cough, sneezing, runny nose, sputum production, nasal congestion, shortness of breath, lethargy, muscle aches and pain, headache, and dehydration. So as you can see, the general signs and symptoms are very similar to common cold influenza. And that's one of the main problems with the coronavirus. And that is, in the very beginning, it's very hard to tell one from the other. Okay? And some patients do have gastrointestinal signs and symptoms as well, about 5 to 10%. And mainly it's going to be nausea and diarrhea. And before the GI symptoms turn into respiratory symptoms. All right? And then, as the disease progresses, it will move from the early signs and symptoms that's very similar to common cold and influenza, and will start to move into the lung. And now you have a lot of patients who then have pneumonia, starting with early phase to mid phase to the more severe phase. And generally speaking, the disease will start to turn deadly when you have the cytokine storm. And what that is the coronavirus goes into the lung and it starts to go into the cells. And once it goes into the cells, it starts to replicate, start to multiply, and the virus then will start to increase exponentially. And when that happens, sometimes the immune system will over-respond or respond in an uncontrollable fashion. And they will send out too much immune cells, and immune cell will release too much of the pro-inflammatory cytokines. And as a result, these immune systems, these cytokines will go into the lung and create excessive inflammation, and at the same time damage the lung lining itself. Okay, so that will further lead to more damage, more inflammation. A lot of the inflammation, in fact, occur in the alveolar space. All right, so at that point, what happened is the lung cannot breathe in any oxygens, and oxygen cannot pass through the blood, cannot go to the rest of the organs. So now what happened is you start with pneumonia, and then the patient has ARDS, acute respiratory distress syndrome. It then goes into sepsis and eventually progress into multiple organ failure. So this is why for some of the patients, as cytokine storm sets in, the disease turns very deadly, and where most of the people die from the COVID-19. All right. And what they have also found is, in addition to the hyperinflammatory injury, the lung suffers from significant damage. So it's not just inflammation, but it's the damage to the lung lining itself. All right. And also physiological damage. So wheezing, shortness of breath, and so on and so forth. All right. So this is a condition in which there is both physical damage and also physiological damage. All right. And when they do biopsy for the lung, what they found out is there is a lot of edema and very thick exudate, a lot of inflammation, a lot of plugs. So basically what's happening is it's not just a loose sputum or phlegm that's in the lung that most patients can easily cough out. What they found is very, very thick, sticky exudate and discharge that's clogging up the very small alveolar space in the lung. So what happened is that's why the patient has difficulty breathing. But if you read most of the descriptions, it's a dry cough that most patients have. So even though they have a lot of phlegm and sputum, it's a very thick, very hard to cough out type of discharge that plugs up the thick part, the small part of the lung. And that's why even though they have a lot of discharge, most of the patient will have dry cough. All right. And also what they found in biopsy is that the lung is no longer like a sponge. Generally speaking, a healthy lung is like a sponge that has a lot of flexibility, has a lot of space. But in this case, it's turning and it's becoming very rigid. All right. So that's why these patients have such a hard time with breathing. All right. As far as Western diagnosis goes, generally speaking, they will start with signs and symptom evaluation. They will start with patients' past 14 days of travel history. They will do a nasal pharyngeal swab, okay? And then, of course, do chest x-ray and CT scans. So these are what Western medicine does to confirm or rule out whether the patient has COVID-19 or not, okay? And what they also found out is the patient do in fact have COVID-19 and they do a CBC, complete blood count. What they found is that lymphopenia, a low lymphocyte, is quite common, and this happens in about 80% of the patients. And also mild thrombocytopenia is also quite common, all right? And what they have also found is that the low platelet count is a poor prognosis for the patients, all right? And as the patients start to get treated, these are some of the common Western medicine treatments. Acetaminophen, aspirin, ibuprofen, and so on are generally prescribed for fever and perhaps muscle aches and pain. Because this is a viral infection, they do try to use antiviral drugs, including remdesivir, lopinavir, and ritonavir. These obviously were prescribed for other virus infections. So the first one is for Ebola virus, and the last two are for HIV. Okay, so basically what they are doing is they are doing a lot of trial and error. They are doing a lot of experimentation because none of these are specifically approved for the novel coronavirus. All right, so regardless of whether it's Western medicine or Chinese medicine, everybody is doing a little bit of trial and error, trying to find out what is the best way to slow down or stop the virus. All right, chloroquine is an anti-malarial drug, and it's also being tried here. The attempt is there is some preliminary evidence that it may slow down the entry of the virus into the cells. Okay, and also chloroquine has a little bit of immunosuppressant effect. So perhaps it can slow down the cytokine storm. All right. The use of steroids is a little bit controversial. On one hand, you will help to reduce the inflammation. Okay, but on the other hand, it may suppress the immune system and therefore make the patient more vulnerable to secondary infection. Okay, it also speeds up the viral shedding. All right, so use of steroid in that sense can be controversial. Immunosuppression drug can also be prescribed primarily if the patient is at risk of cytokine storm, in which the immune system is responding in a dysfunctional or uncontrolled fashion. So this is to help to suppress the autoimmune-like type of response from the patient. And then eventually, as the patient has ARDS, they have trouble breathing and so on, then the ventilator will have to be used, as well as ECMO for heart and lung support. Okay. And this is another very old, but something that they are starting to explore called the convalescence plasma. So basically what they are doing is for patients who have COVID that have recovered, okay, the idea is their immune system overcome the virus and they develop antibodies. So what they're doing is they are taking the blood from these patients that have recovered, and they are taking the antibody from the survivors and giving it to the infected patients. All right. So this is originally how all the antibodies were extracted, and also how a lot of the vaccines and antivenoms were developed. And this is also in the past how Chinese medicine treats a lot of the poisonous situations, where they take the blood from the animals or blood from the recovered patients, and they gave it to the patients. All right. So this is possibly another treatment option. All right. And obviously the cure is if you have, well, there are two possible cures. One is if your immune system is able to overcome the virus and you develop the vaccine, develop the antibody on your own. And the other is a vaccine. However, drug development, clinical trial and error, and as far as approval, does take some time. So the best guesstimate right now is that we are still a year to a year and a half before the vaccine is available. All right. So at this moment, the big picture prognosis is that up to 70% of all the people will at some point in time get COVID-19. And this is what Angela Merkel basically told the German population. So we in the US should really not be at an exception. Okay, but the good news is most of the patients will have only mild illness. They do not require medical attention and are not counted. All right, or the people that are confirmed to be infected, okay, greater than 80% or so don't become significantly ill and do not require hospitalization. And also another good news is patients that are under 18 years of age only make up 2.4% of all reported cases. And this is a summary from the WHO Commission. However, what that means is even though young patients are at less risk, that means older patients greater than 60 years of age, especially if they have pre-existing health conditions, will then have the highest risk. Okay, so among the patients that are hospitalized, 10 to 20% will be admitted to ICU, 3 to 10% will require intubation, and then the mortality is somewhere between 2 to 5%. All right, and then for those people that do survive from the hospitalization, what happened is like we mentioned, their lung is severely damaged. So even if they are discharged, a lot of them will require a ventilator. Okay, and one of the biggest problems, of course, is we don't even have enough ventilator in most cases, even for the patient in the hospitals. Okay, so this is going to be a great challenge for the initial period and also for the later period as the patients are discharged. All right, so that is from the Western perspective. All right, from a TCM perspective, the big picture is that there have been at least 320 large-scale epidemics in China between the Eastern Han and the Qing dynasty. So that's about a 2,000-year period or so. So this is definitely not the only one. And historically, how the Chinese medicine has always approached this is through two of the main theories in TCM. One of them is Sanghan, which is co-induced disorders, in which the disease progression is described from Tae-Yong, Yangming, Shaoyang, Tae-Yin, Shaoyin, and Jue-Yin. So basically the infection starts from the outside, gradually goes inside, and as it moves inside, it becomes more and more severe. And then the other theory is Wenbing, worm diseases. And similarly, even though the terminology is different, the disease also starts on the exterior and then gradually move interior. And the reason I want to mention this is because COVID-19 is really no different. And as we get into differential diagnosis and also all the formulas, what you will notice is that a lot of the thinking behind the diagnosis, thinking behind the herbal formula composition are basically the same way. Okay, the names are a little bit different, the formulas are slightly modified, but in the end, the big picture is the same. All right, so very quickly, let's go over some of the major signs and symptoms and what they mean in TCM. So the early stage of fever, dry cough, sneezing, runny nose, lethargy, muscle aches and pain, so on. This is basically the Tae-Yong syndrome, mainly with wind cold or with wind heat. Or if you follow the Wenbing theory, the worm disease theory, the disease at this point is mostly at the way or the defense level. All right. And what we also mentioned is that a lot of the COVID patients that test positive that require hospitalization, they have underlying lymphopenia and also thrombopenia. Okay, and what that means is that these are probably patients that are older or weaker in the first place, right? So lymphopenia is similar to Qi deficiency in Chinese medicine, and thrombopenia is blood deficiency. So if you have pre-existing deficiency, that means you are more likely to catch the infection. All right? And then as the virus multiply and as the immune system kicks in, trying to fight the disease, now what you have is a severe inflammatory disorder. Okay, you have a lot of fever, you have large pulse, you have shortness of breath, you have inflammation in the airway. All right, so at this point in time, most of the signs and symptoms are the excess. All right, so this is a Yangming stage where there's a lot of heat. This is a Qi energy level. Once again, there's a lot of heat, there's a lot of fire. All right, so at this stage, you mainly need to use herbs that clear heat and purge fire. And then as the virus start to damage the inner lining, cause a lot of inflammation, cause the body to produce a lot of edema, proteinaceous exudate, very thick plugs, and so on, then what happens is the disease is affecting, as far as the Zangfu organ is concerned, mostly the lung, right? So there's a lot of damp, there's a lot of phlegm, okay? Damp is mainly the feeling of congestion, stifling sensation. Phlegm is a very thick discharge, the very thick exudate that's blocking the alveolar space. Okay, so in most cases, even though the patient has a dry, non-productive cough, but they still have a lot of damp and phlegm in the lung. And with that, patient can also have lung heat and lung cold. Okay, lung heat mainly means the patient's body is still fighting quite a bit. Okay, so there's a lot of fever, there's a lot of inflammation, there's a lot of infection. Lung cold mainly means as the disease starts to progress, okay, it's depriving the patient of oxygen, so they have trouble breathing, all right? So their face is going to start to slowly turn darker. Their tongue will also turn darker. They are not getting enough oxygen into their body, all right? So at that point, the lung presentation will change from lung heat initially and slowly into lung cold. All right, and then if the cytokine storm does kick in, okay, then what happens is not only is the lung not getting enough oxygen, the rest of the organs are not getting enough oxygen. Also, not only is there a lot of phlegm and fever and inflammation, the cytokines and immune cells are starting to damage the tissues inside the lung. So now what you have is both excess and deficiency, heat and cold at the same time. So this is now transitioning from the Tae-Yong and Yangming to the Shaoyang stage, right? There's alternating heat and cold, okay, fever and chills, right? And then when it goes past that stage, the patient then starts to have multiple organ failure. So at that point, it's really, really bad. Okay, now we are looking at Tae-Yin, Shao-Yin, and Jue-Yin stage. And from a Wen-Bing perspective, you're looking at Yin and Xue. All right, so generally speaking, that's really bad news. Okay, these patients, it's going to be very hard to treat, very hard for them to recover. So the idea is you try to prevent the patient from progressing to that perspective as much as you can. All right, and then of course, if they do recover, then what happens is they recover, but they are left with a lot of physical injury to the lung and also physiological injury to the lung functions. All right, so that's why these patients, when they're discharged from the hospital, many of them still have a lot of breathing problems. They will still need ventilators. So basically at this point, they are discharged, but they are left with a lot of lung insufficiency and also lung qi deficiency. All right, so if you look through that cycle of what it's like to have COVID-19 starting from the beginning to the end when they recover, then you can kind of see the big picture, right? Either with Sanghan or Wen-Bing. Basically, the disease starts from the exterior, it goes to the interior. And as it goes to the interior, obviously it affects the lung first. And then, if it's not treated, then it affects all the rest of the body. And even if they heal and recover and are discharged, they will still end up with a lot of lung in and lung qi deficiency. All right, so let's now go into a little bit more of the specifics. Here's another quick general stats. So as of late February, okay, Chinese medicine have been utilized in most of the patients in China who have COVID-19. In fact, more than 85% of all the patients with coronavirus, which is approximately 60,000 patients or more, have all gotten herbal treatment along with Western medicine treatments. All right, so even though this is a novel coronavirus, we do have a lot of data, we do have a lot of patients, and from that, hopefully we can learn something and we can continue to improve and continue to get better. And what I will share with you today, the next 20 minutes or so, is 3 primary protocols of how COVID-19 is treated in China. The first one is the treatment protocol from Hubei Provincial Hospital, Hubei Shengzhong Yiyuan, and the second one is from Wuhan Union Hospital. And the last one is the official guidance of COVID-19, and this is the official PPRC guidance. And basically what you'll see, and this is to give you the roadmap before we get into the detail, is that they all more or less classifies everything into 4 main stages. Okay, the first one is going to be the prevention stage. So this is for patients that are still otherwise healthy, okay, but as we mentioned earlier, 70% of us are going to be exposed and probably have COVID-19, okay, but most of us have mild or no symptoms. So the prevention phase is while someone is healthy, what can we minimize the chance of them getting coronavirus? How can we help to minimize not only the exposure, but if they are exposed to it, from developing the more severe signs and symptoms? All right, so this is the prevention part. The next phase is going to be the early phase. So this is in the very beginning when they start to show a lot of the generic non-diagnostic signs and symptoms. Fever, dry cough, malaise, okay? Right? If you have that, there's really no way to tell whether you have COVID-19, you have common cold, influenza, or things like that. All right, so what happened is as soon as they start to show these generic signs and symptoms, you have a different set of formula that are used to treat the whole wide spectrum of these possible viral infections. And obviously, in China, they will start to do the test right away. In Korea, they're also very aggressive with testing. In the US, hopefully within the next week or 2 or 3, testing will be more prevalent, will be more available, so they can confirm or rule out whether you have coronavirus or not. Okay, and in fact, if you do, and if it starts to show lung signs and symptoms, the next one will be the pneumonia phase. So this is where they start to treat whether you have mild case of pneumonia, more serious pneumonia, whether you have ARDS or cytokine storm. So all these are the pneumonia phase, all right? And then lastly, if the patients do recover and discharge, then what do they do for the patient who have recovery phase? All right. So what happened is all these three main protocols have variations. They are not all exactly the same. But basically what they all do is they all offer the similar roadmap. Okay, much like Sanghan and Wenbing. They offer the similar roadmap in which there is prevention, there's early phase or generic viral signs and symptoms, there's a pneumonia phase, and there's a recovery phase. All right, so they are, like I mentioned, very similar. All right, so this is the first one. Hubei Provincial Hospital, TCM, they divided into 4 phases. And if you dive into a little bit more, the early phase and pneumonia phase will then have a subset of differential diagnosis. Okay, so depending on where you are, these are the standard treatments that are then given to the patients in this particular hospital. So the prevention phase, once again, these are the patients that are otherwise healthy. Okay, this is the formula they give to the patient. And if you look at this, I think most of you should be able to identify what classic formula this is, right? You have Huangqi, astragalus, Baisu, atractylodus, and Huangfeng, Siler or Saponischkovia. This is the classic formula called Yu Ping Feng San, the J windscreen powder. All right, so the J windscreen is implying that this formula will provide a barrier, a quarantine between you and the virus. Okay, so in today's term, this is obviously the mask, the glove, the social distancing, the distance, and so on. So this is a formula that will help to stimulate your Wei Qi, boost your immune system. So if you have pre-existing lymphopenia, you have low white count, this will help to address that and help to minimize your chance of catching a disease, especially your immune compromise. But what happened is, and you'll see this over and over again, it's not enough to just use that because, like we mentioned, we are all going to be exposed to the coronavirus at some point or the other. We might, hunker down at home, not go to crowded places, but we still have to live a life. We still have to go buy food and so on. So most likely at some point, we will be exposed to the virus. And when that happens, you also want the formula in the prevention phase to have some herbs that are the antiviral herbs. All right, so not only do you have immune system that's fighting against the virus, you also have herbs that also help to fight the virus as well. So there are 2 herbs in this formula that does that. One of them is Myanmar Guanzong, which is Dryopteris, and the other one is Jininhua Lanesera flowers. All right, so Lanesera flower, I'm sure most of you are familiar with already. It's part of the formula called Yin Chao San. Right, so it's a great formula for treating common cold, influenza, and they also have effect against coronavirus. And I'll show you more information later on as we talk about specific research. Myanmar Guanzong, you may be wondering, because this is traditionally used as an anti-parasitic herb as the first option. But in fact, the secondary function is that this is also a great herb to treat viral infection as well. So you do see this herb used quite a bit for prevention and also early stage of treating coronavirus. And then finally, Chen is to help to move the lung qi, and Peilan is to get rid of the damp and phlegm. All right, so this is what the gist of the prevention formula for Hubei Provincial Hospital. All right, this is the acupuncture recommendation, basically to massage these points for 10 minutes, twice a day. All right. If the patient do get past this, or not, but if the disease does get past that, right? So in addition to prevention, now the disease is starting to attack the exterior. All right, so the patient initially will show wind cold invading the exterior, or it could be wind heat, or the disease is starting to attack from the exterior to the throat, and it's starting to affect the lung. Okay, so now it's no longer prevention. Huangqi is no longer effective. But rather, what you need to do is you need to start to use herbs to attack the virus and also help the body to attack the virus and treat all the signs and symptoms. All right, so if the patient has early stage wind cold attacking the exterior, you have onset of fever, low-grade fever, aversion to cold, chill, headache, ticklish throat, soreness of the muscle of limbs, no sweating, and so on. Lung CT is still negative, so this is mostly exterior, is not quite interior yet. So the TCM protocol at this time is to expel wind, release the exterior, clear heat, and detoxify. The herbal formula of choice in this case is Ge Gen Tang or Cai Ge Jie Ji Tang. So both of these are formula that treat Tae-Yong cold, wind cold, mostly with cold constricting the exterior, causing a lot of vasoconstriction, causing a lot of muscle aches and pain. So these two formula will help to treat the wind cold at the exterior, relieve muscle aches and pain, dilate the blood vessels, help the blood to flow to the exterior, help the blood to flow to the lung, help the blood to flow to the nasal cavities, to hydrate the nasal cavities so the body can send oxygen, white blood cells, immune systems to the disease area, and basically help the body get rid of the virus. All right, so most of the herbs in this case are to help the body to help itself to get rid of the virus. Okay, so that's basically what Ge Gen Tang does and Cai Ge Jie Jing Tang does. But the modification here is Jin Yin Hua once again is also added, right? Nausea flower, because this is the one herb out of this formula here that has a significant antiviral effect. All right, so once again, not just to help the body to help itself, but also to add antiviral herbs. Historically, that's a heat clearing and eliminate toxin type of herbs. All right, if the disease starts to attack the lung, all right, so it's still mostly exterior, but it's starting to move interior. The patient may have these signs and symptoms: fever, aversion to cold, sore and dry throat, dry cough, scanty sputum, sore painful muscle in the limbs, weakness, headache. CT will reveal that the lungs start to have scattered ground glass opacity. So you can start to see that the lung is starting to inflame and get affected. All right, so treatment protocol in this case is to expel wind, release exterior, clear heat, and detoxify. All right, so the formula once again is Yin Qiao San plus Qing Wen Bai Du San. Yin Qiao San is honeysuckle and forsythia powder. Qing Wen Bai Du San is clear epidemic toxins and overcome pathogenic influence. All right, so once again, you still need to have herbs that treat the virus, and that's Jin Yin Hua and Lian Qiao. So those two are still the primary herb, Nausea and forsythia. So as the disease starts to move interior, okay, then sometimes you will see formulas use Huang Lian or Huang Qin, which are Coptis and Scutellaria. Okay, so in this particular case, Huang Lian is used. Huang Lian and Huang Qin both have excellent heat clearing effect. All right, but the difference with Jin Yin Hua and Lian Qiao is that Huang Lian and Huang Qin, generally speaking, have great antibiotic effect, but they tend to be more antibacterial and less antiviral. Jin Yin Hua and Lian Qiao, Nausea and forsythia are both excellent antibiotic herbs as well, but they tend to be more antiviral and less antibacterial. Okay, and then you, of course, you have the rest of the supporting herbs. Okay, again, if the disease continue to move interior, then there's a diagnosis called a damp cold in the lung. All right, so once again, damp referring to the early stage of inflammation, of edema, of the protein discharge that's starting to block the alveolar space. All right, so these patients have aversion to cold, fever, absence of fever, dry cough, dry throat, fatigue. They have weakness, chest stuffiness, epigastric distension. All right, so these are indications that they are starting to have some breathing difficulties, then possibly nausea and vomiting. All right, so the key here is to expel wind, release exterior, dispel wind damp. All right, so this formula here is mainly a formula to get rid of damp and phlegm to help with the lung, with a lot of Ma Huang, of course. But none of the herbs here are antiviral herbs or herbs that clear heat and eliminate toxin. All right, so if we know for sure that the patient has COVID-19, then personally, I would add some herbs to eliminate heat and toxin, whether it's Jin Yin Hua and Lian Qiao, or Ban Lan Gen and Da Xing Ye, Isatus leaf and Isatus root, or anything along that line. That way, while you are alleviating the signs and symptoms, you also have some herbs that help to fight the virus as well. All right, and these are the acupuncture and moxa suggestions for the early phase. All right, and then as the disease moves interior. now we are at pneumonia phase. All right, so this is when the patient's lung functions are severely affected. Okay, and this is the critical time, because if you can stop it at the early phase, you will significantly improve the patient's prognosis. And the 4 main differential diagnoses in the pneumonia phase is a Chou-Heung syndrome with DAMP affecting the lung, toxic stagnation obstructing the lung, and then finally closed interior and abandoned exterior syndrome. All right, so the first one is Chou-Heung syndrome with DAMP. Chou-Heung, once again, like we mentioned earlier, is the very beginning when the disease start to alternate with exterior and interior. There's some heat, there's some cold, there's some excess, and there's some deficiency. So this may be the phase when the inflammation, when the infection is starting to affect the function of the body, but also is damaging the lung at the same time. Okay, so there is both excess and deficiency. Signs and symptoms are fever, alternating chills and fever, cough, absence of wheezing, bitter taste in the mouth, and so on and so forth, right? And then CT reveals that there is definitely effect to the lung as well. Okay, there's red tongue, thick and greasy, yellow or yellow tongue coating, slippery and rapid pulse. So in this case, we need to harmonize the Chou-Heung and also clear the DAMP. And once again, DAMP refers to the edema, refers to the inflammation, refers to a lot of the plug that occur in the lung where the patient is starting to have a lot of trouble with breathing. All right. And the formula recommendation is 3 main classic formulas combined and also modified at the same time. One is 小柴胡汤, minor popular combination. One is 三仁汤, the 3-nut decoction. And the last one is 甘露消毒饮, sweet dew special pill to eliminate toxins. So the gist here is 小柴胡汤 is to harmonize the Chou-Heung syndrome, the exterior and interior. 三仁汤 is to get rid of the damp and phlegm. And 甘露消毒饮 is to eliminate toxins. So toxins refers to the pathogenic factors. So historically, the pathogenic factors could be various type of microorganisms. Okay, it could be bacteria, could be virus, and so on. And this is the exact composition of the formula, right? So the first 2 are 2 of the chief ingredients in 小柴胡汤, where you have 柴胡 populorum and also Huangqin scutellaria. And Huangqin is good here because Huangqin is a great herb that clear heat from the upper jiao, much like we discussed about Huanglian earlier. And I think Huangqin is a little bit better because it's more specific for the upper jiao, and Huanglian is a little bit more specific for the middle jiao. All right, then you have other herbs. You have Xingren, Yizhen, Baidoukou. So those are the seeds or the nuts that help to clear the phlegm. Okay, so this is how the formula is composed specifically for the Chou-Heung syndrome with DAMP. And the next diagnosis is if they have DAMP affecting the lung. So once again, DAMP is referring to the edema, to the inflammation, to the difficulty breathing in the lung. But once again, don't be fooled by the dry cough, but because the DAMP is very deep. It's a dry type of DAMP. It's very hard to cough out. So if they do, it's going to be very little. So it's scanty sputum. Okay, and the heat part is referring to the inflammation, to the infection, the body temperature, and so on. All right, so once again, those are the general signs and symptoms. The lung is affected as shown on CT. And then what we need to do is transform dampness, eliminate toxin, disperse the lungs, and expel the pathogens. The formula recommendation is Ma Huang Ephedra, apricot kernel, choices, and licorice decoction. And this is a formula that will help to both open up the lung with Ma Huang and also get rid of the phlegm. 小线胸汤, minor sinking into the chest decoction, is a formula for treating when the exterior pathogen starts to move interior and sink into the lung. Okay, so in this case, much like pneumonia, much like bronchitis. And then 草果知母汤 is to get rid of the damp and also clear the deficiency heat. All right, so Ma Huang in this case is one of the most important formula, and also one of the most important herb that cannot really be substituted because it has a very potent function to dilate the lung, to bring the lung qi downwards. So any patient that has wheezing, dyspnea, asthma, bronchitis, pneumonia, you really have to have this herb. Okay, then you have Xi Xin that help to drag the qi down, get rid of the phlegm. You also have Huang Lian, okay, and so on. Okay, another herb that's quite important here is Yu Xing Cao, Herba Ephedrae. And this is another herb that historically is described as an herb that clears heat and eliminate toxin. So we have quite a lot of herbs that are described to clear heat and eliminate toxin. But Yu Xing Cao, similar to Guanzhong, happens to be one that works very well to treat virus infection. And once again, I will discuss the exact pharmacology a little bit later so you can see how it works. All right, so this is a formula used for damp heat affecting the lung. If the patient has toxic stagnation obstructing the lung, generally speaking, the term toxic, when it's used, that means the patient has some type of infection. In addition, where there's a lot of mucus, there's a lot of pus, there's abscess, there is some kind of discharge. All right, so usually when we say eliminate toxin or detoxify, usually that's what it means. You see those type of signs and symptoms, abscess, pus, discharge, and so on, before we use the term toxin. All right, so anyhow, the general signs and symptoms are cough, stifling sensation, stuffiness, distension in the chest, asthma, wheezing that gets worse with exertion, and so on and so forth. All right, so we need to eliminate the toxin, relieve wheezing, transform blood stasis, and open the collaterals. All right, the formula is 白虎加人参汤 plus 四土汤. So this is a white tiger plus ginseng decoction combined with 4 earth or 4 wild decoction. And the main herb here is the 白虎加人参汤, the white tiger decoction, because you need a very strong formula to clear lung heat. And 白虎汤 is the best choice. And then Rensen is added because these patients are starting to become very weak and very deficient. All right, so you need to tonify their qi. Historically, this formula uses Rensen, the Panax ginseng. But in this case, Xi is used. And the reason is because Rensen is too warm, too hot. For patients that have infection already, it may not be the best choice. So you need to, if you can, modify the formula. Either use Dangsen, Cotonopsis, or use Seng Sai Sen, which is the ginseng that is sun-dried. It's not steamed, so it's not warm. So not the Korean ginseng, not the red ginseng. But you use Cotonopsis, or use American ginseng, or use the sun-dried Rensen. Okay, so that's the primary formula. And then the rest of the herb is to help to facilitate the lung function to get rid of the phlegm. And when you have phlegm in the very deep parts of your lung, then one of the best herb to use is the second one from the bottom called Ting Li Zi. Ting Li Zi is usually Lepidum or Descurania. All right, so this is one of the strongest herbs to eliminate phlegm, especially the phlegm that's deep inside the lung that is very hard to get out. Okay, so this is the strongest and probably the best herb in this case. And then finally, if you have somebody with closed interior and abandoned exterior syndrome, basically this means the patient has ARDS, has sepsis, has cytokine storm, and probably is experiencing multiple organ failure. So they are mentally incoherent, all their organs are starting to shut down, and this is the very last phase before they eventually may die. So this usually calls for dramatic measures. Basically, you 四逆加人参汤 plus 安宫牛黄丸 plus 止血散. So 四逆加人参汤 is a frigid extremity decoction plus ginseng. You take it with calm the palace pill with cattle gallstone, and 止血散 is a purple snow powder. And basically, the first formula is like a resuscitation, and the last two is something that help. Well, resuscitation for the heart, basically to strengthen the heart, to activate the heart. And the last two are to resuscitate the patient, help them regain their consciousness. All right. So hopefully the patient never gets to this point, and if they do, it's going to be very, very difficult to treat. All right. And lastly, of course, we hope the patient to recover, but once they do recover, they do have a lot of consequences from the disease itself, possibly from all the treatment. But in any case, anytime they recover from an infection, infection itself is heat, right? So regardless of whether they are then treated with antibiotic or heat-clearing Chinese herb, what happened is the heat from the disease or cold nature from the drug or herb most likely will damage Qi and damage Yin. So these patients, when they are discharged, really need to take Qi and Yin tonic herbs to help them to speed up recovery as much as possible. So the standard formula in this case is Sa Sen, Mai Men, Dong Tang, Glenia, and for Ophiopogonus decoction. And this is the formula that's obviously slightly modified. All right, so that's the idea behind the whole course of treatment from the beginning to the end. And once again, this is from the Hubei Provincial Hospital. These are the acupuncture points recommendations. The second one, treatment protocol, is from Wuhan Union Hospital. Okay, and once again, the progression, the classification of the disease is a little bit different, but they are more or less the same. As you can see, the first two or three are the first one is prevention. Okay, so that part is the same. The second two is wind heat invading the exterior and damp warmth in the early phase. So both of these are the early phase when the patient start to have generic signs and symptoms. So once again, fever, dry cough, fatigue, malaise, maybe a little bit of shortness of breath. All right. And then after that, you have three primary differential diagnoses for the pneumonia phase. So you have damp heat obstructing the lung, you have epidemic toxin blocking the lung, and also closed interior and abandoned exterior. Okay, and then finally, if they are discharged, they usually have insufficiency of Qi and Yin, as well as deficiency of the lung and spleen. All right, so let's look at some of the formulas that are recommended in this case. So for prevention, according to Wuhan Union Hospital, once again, if you look at the first three herbs, it's the same as the previous case. Huangqi, astragalus, Bai Su, Atractor lotus, and also Fang Feng cider, right? So once again, this is the Yu Ping Feng San, the jade windscreen powder. So the idea is the same. There is a consensus that this is the best structural foundation to start with. But at the same time, they also recognize that is not enough, because once again, we are all going to be exposed to the virus at some time, and we want as many tools to help us fight it off as much as possible. So not only do we need to tonify Wei Qi, we also need to add in antiviral herbs. So these are the herbs that clear heat and eliminate toxins. So in this formula, you have Guanzong. Once again, this is primarily an anti-parasitic herb, but its secondary but also very effective function is to treat common cold, influenza, viral infections. All right, so this is added. And then you also have Yu Xing Cao, Huttanania. So this is another great herb to also treat viral infection, along with Lian Qiao, Forsythia. So there are three herbs here that are very effective as herbs to treat viral infections. All right. Then Huoxiang is added in this case. And Huoxiang, it's up to you. If the patient has coronavirus, they show gastrointestinal signs and symptoms like we mentioned earlier, but that's only a small amount, maybe 5 to 10%, then Huoxiang is good, much like the classic formula Huoxiang Zheng Qi San. But if they don't have GI symptoms, then this herb may not be necessary. All right. If the patient start to show generic wind heat signs and symptoms, headache, sore throat, cough, thick tongue coating, red tongue tip, all right, then the formula that's recommended is similar to the classic formula in Qiao San, Lanisra and Forsythia powder, right? You look at the first two ingredients, Jininhua, Lanisra, and Lian Qiao, Forsythia. Okay, this formula is also a little bit aggressive in that they also added the main ingredients from Xiao Cai Hu Tang, the minor bupleurum decoction. So you have Cai Hu bupleurum, you have Huangqin scutellaria, you also have Banxia Panelia, right? Then you also have Ban Lan Gen and Da Qing Ye, the Isatus root and Isatus leaf are also excellent antiviral herbs. So basically, this formula is assuming that even though the patient is mostly showing exterior wind heat signs and symptoms, it's adding herbs to prevent it from going further inside. Okay, so it's to treat the wind heat as a main diagnosis, but also in addition, trying to prevent it from going further interior. Oops. All right. If the patient has condition that starts to move interior, right? So this is a damp warmth. Damp, once again, is the lung starting to having problems, with feeling of oppression, feeling of stuffiness, and so on. And at the same time, warmth is they're still having the infection and inflammation. All right, so this is the formula that is used. So once again, a lot of herbs that clear the wind heat from the exterior, Jinlin and Lianqiao. You also have herbs that's in Xiao Cai Hu Tang, minor purpureum decoction. You have Cai Hu purpureum, Huang Qin Scutellaria. You have Ban Xia Panelia. You also have a lot of herbs in here that help to open up the lung, right? You have Xingren, Armeniaca, apricot seed. You have Herbu, Magnolia cortex. You have Ma Huang, Ephedrae. Okay, and one interesting herb that's used here is the last one here called Hong Jing Tian rhodiola. So most of you may not be familiar with this herb, but this herb, one of the main function, one of the main indication today is to help people adapt to altitude sickness. And in fact, a lot of people that go visit Tibet, they have a lot of trouble adjusting to the high altitude. So what this herb does is it has been shown to help with that change of climate very well. Okay, so when people go from the city to Tibet, they can adapt to the altitude, they can adapt to the lack of oxygen, they can adapt to those situations very well. So what happened, my interpretation of why this herb is added is these patients with COVID-19, as they start to have pneumonia, to have lack of oxygen, have trouble breathing and so on, this herb is perhaps added to help them adapt to that hypoxia type of settings. Okay, so that's in my interpretation of why that herb is in here, because historically, you really don't see Hong Jing Tian used in any classic formulas. All right, if the patient has damp heat obstructing the lung, generally you are starting to see the early stage of pneumonia. All right, so in addition to dry cough, breathing becomes significantly more difficult. All right, so once again, you need to start to treat the lung more. At this point, basically, the disease is no longer exterior, it's mostly interior. So you need to treat the damp, you need to treat the breathing, you need to treat the phlegm, you need to treat the infection, inflammation, and so on. So disease is primarily in the interior now. So the shift is no longer at the exterior, so you don't see Jinlin and Lianqiao in this case, but rather you see a lot of seeds type of herbs. You see a lot of like Yi Ren, you see Donggua Ren. So Yi Ren is Semmencoises, Donggua Ren is Benicasa, you see Ku Xing Ren, right? So most of these herbs are to get rid of the phlegm, get rid of the damp in the lung, okay? You also have herbs that make up Xiao Cai Hu Tang because this is the alternating phase, right? You have Cai Hu, Huang Qin, and then once again, you also have Hong Jing Tian rhodiola, right? So once again, this is to help the patient to adapt better to the lack of oxygen. All right, and the last here is you have Cao San Xian, which is 3 herbs that are helping the patient to strengthen the digestive system. Okay, and then if the patient starts to have epidemic toxin blocking the lung, okay, you have fever, severe breathing difficulties, wheezing, severe hypoxia, dark red tongue. So in addition to the pus, abscess, mucus plug, they're having a lot of trouble breathing. So you start to see a lot of cold signs and symptoms as well. So once again, like I mentioned earlier, Ting Li Zi, the first herb, Lepidum, is the best herb to go deep into the lung and how to get rid of the hardest, stickiest, the most difficult to get rid of phlegm that's in the lung. All right, so generally speaking, that is the best, strongest choice to treat those situations. And again, you have many herbs that are the seeds, right? Yi Ren, Semmencoises, Donggua Ren, Benicasa, Tao Ren, Cinnamon persica, and so on. So once again, these are all herbs that help really to loosen up the lung, okay, so you can get rid of it. Okay, and then the rest of the herb, some heat clearing herbs, some herbs eliminate the toxins, and so on and so forth. All right, but I just wanted to point out the main herbs, okay, and the rest of the herb, if they are self-explanatory, then they are self-explanatory, right? And once again, the last part here is patients that have closed interior and abandoned exterior. So once again, unfortunately, this is the last and most severe condition. Hopefully, the patient was able to recover before that, because this is going to be very difficult to treat. treatment plan is the same. Basically, you use 四逆加人参汤, frigid extremity decoction plus ginseng, and use 安宫牛黄丸 to help to resuscitate the patient. But in this case, the Wuhan Unit Hospital also do something very aggressive, which is injection of the Chinese herbs. Okay, so obviously we cannot do that in the US, so this is only for your reference. Okay, and then finally, as they are discharged, they end up with qi and yin deficiency, lung and spleen deficiency. All right, so to help to speed up the recovery, the formula, the base of the formula is the same as the previous case. So you have Sa Sen, Mai Dong Tang. So Sa Sen is a Glenia and Adenophora, and Mai Dong is the Mai Men Dong or Pheophilgonus. Okay, so these are the herbs to help to nourish in and tonify qi, because remember, these patients have both damage to the anatomy and compromise to the physiology. So they have form and function problems, right? So the form and anatomy refers to the yin damage, and the function refers to the qi. Okay, so basically yin damage and qi deficiency. All right, the last one is the guidance for coronavirus disease 2019. Okay, so this is the official publication from the PPRC, and in fact, we are now in the 7th edition. Okay, so this is how quickly the information has changed, starting from either the late 2019 or early 2020. And we are in March. So PPRC has already published its 7th edition, okay, for how to best manage COVID-19. This is the English edition. This is edition 6. Okay, and in fact, yesterday, I only had the draft for 7th edition. And today, this morning, it became official. Okay, and 7th edition is also available in both Chinese and also in English. All right. Anyhow, the official guidance divided everything into 3 phases: medical observation period, clinical treatment period, and also finally the recovery period. And then during the treatment period, it divided into quite a few differential diagnoses, as well as 2 for recovery period. But what happened is, as I look into this, the idea is basically the same. Idea is that you start from prevention, then early phase, then pneumonia phase, and recovery phase. The exact term used for differential diagnosis is a little bit different. The formula composition is slightly different, but the idea is the same. All right, so the English version is available. You can actually download it. We have it at the Lotus website. You can go to the resource page, and you can click on it for the complete English version or the update for the 7th edition. But anyhow, my point is, by this time, what happened is they have had so many patients in China in early phase in the hospital and so on. They basically don't have the time to do differential diagnosis. And I'm sure you have heard the doctors in these hospitals, when they work their shift of 6 to 8 hours, what happened is they all wear the hazmat suit, right? They are completely covered, from a suit to a goggle to mask to gloves and so on. And what they are told is during their shift, there's no food, there's no water, there's no breaks, and there's no bathroom. Okay, and they all have to wear diapers. And the reason is because they don't want these doctors to take a break, take off all their suit, and then be exposed to possibly getting an infection. And also, so that's what happens. All right. So basically, if they don't even have time to take break, there is no time to do differential diagnosis. And that's why we end up with what we have, which is basically the main formulas. And then what happened is the China government will then prepare all the herbs in decoction and give it to all the patients for free. But they don't have time to do differential diagnosis or custom formula. So basically, everybody gets the same thing. And one of the same thing that everybody gets is this formula called Qing Fei Bai Du Tang. And this is the formula they give to all the workers that work in the hospital to treat COVID-19 patients, and also all the patients that show the initial signs and symptoms as they possibly may start to have pneumonia. Okay, so this is, I guess, their guidance formula or their one-size-fits-all formula, and this is the exact composition of that formula. And if you look at it into a little bit more detail, It's basically a breakdown of 4 primary formulas. The first one is Ma Xin Gan Si Tang. So Ma Huang, Ephedra, Xingren, apricot kernel, Gan Cao, licorice, and Si Gao gypsum. So this is a formula that treats lung heat. So these patients have high fever, lung infection, difficulty breathing. So that's why you have those 4 herbs, right? Then you have Xiao Cai Hu Tang minor popular decoction, which you see quite a bit in all the previous formulas. So this is a formula that treats Chou-Heung syndrome, where there's exterior and interior factors, there's excess and deficiency, there is alternating fevers and chills. Then you also have Se Gan Ma Huang Tang, Bellam Kanda, and Ephedra decoction. And this is a great formula for treating lung heat with a very thick, sticky phlegm. Okay, so kind of like what a lot of COVID patients have. And then finally, Wu Ling San, 5-ingredient formula with poria. This is to help to get rid of edema, the discharge, the fluid buildup. All right, so these are the 4 herbs that make up the formula, Qing Hui Pai Du Tang. Okay, recommendation is drink the decoction water warm twice a day, 40 minutes after meals. All right, and this is the general statistics that's reported in the news media. Of 701 patients in 10 provinces, hospitalized patients that take this formula, 130 recover, 51 had resolution of the signs and symptoms, 268 had improvement, 212 had stabilizations. So they claim to have 94.3% rate of effectiveness. All right, but what happened is the challenge of that formula, if you want to use that, is number one, Ma Huang Ephedra is not allowed for many of the countries outside of Asia, okay, because Ma Huang has ephedrine alkaloids, and ephedrine alkaloids have potential for abuse. Anyways, that's another topic for another day. So Ma Huang cannot be used. A lot of people have asked, well, Mormon tea, which is also a plant from the Ephedra genus, would it be a good alternative or substitute? And my reply is usually no. And the reason is because Mormon tea does not have ephedrine alkaloids. Therefore, it's not going to be effective to open up the airway. Okay, so possible substitute from a Chinese herb perspective are or include Dilong, Ferritima or earthworm, Ku Xingren, apricot kernel, or Zishuzi perilla seed. Okay, so I would say these are obviously not going to be the same, but probably the best that we can do. Okay, another herb that's not available is Xi Xin asarum, and the reason is because this herb contains urushiolic acid, which is banned by just about any of the Western countries, including US, Canada, and just about all of Europe. And urushiolic acid, once again, is another topic for another day. And this is an herb that do 2 things. It releases the exterior when cold and also warm the lung to dispel phlegm at the same time. So there's not one herb that can be used to substitute both functions. So you really need to choose at least 2 herbs. One would be Jianghuo Notopterygium or Fangfeng Siler or Saponicovia to release the exterior. If you need to warm the lung and resolve phlegm, then either Ganjiang dry ginger or Baijiezi synapsis. Okay, and another herb that's not available is Guangdonghua, and the reason is because this herb contains pyrrolidazine alkaloid. And once again, that's another topic for another day. But this herb is an herb that moistens the lung, descends qi, dissolves phlegm, and stop cough. So your possible substitutes include Ku Xingren, Ziwan, Asteris, and also Zishuzi. So those are some of your choices. All right. So overall, as you can see, the big direction is the same. The big direction of how to treat this is basically like the Sanghan, the cold-induced disorder, or Wenbing type of scenario. Basically, the disease go from exterior to interior. So we need to ideally start with prevention. Hopefully, they never get the disease in the first place. Then we follow up with early stage. When they start to see the first generic signs and symptoms, try to release the exterior, try to treat the wind cold or wind heat as much as possible. You then move into the pneumonia phase. Basically, this is interior, this is lung heat, along with a lot of damp and phlegm. and then finally the recovery phase, they will all more or less have qi deficiency and yin damage. So you need to prescribe herbs that tonify qi and nourish yin. All right, so the exact roadmap may be different, the exact formula may be a little bit different, but what we all need to do is be a little bit creative. Okay, so whatever that's not available, it doesn't mean you cannot help the patients. There are many possible options that are available. Okay, I didn't spend a lot of time on acupuncture, so this is a journal that specifically talk about acupuncture in the treatment of COVID-19, and the reference is at the bottom. You can click on that and it'll take you right to the link. All right, I'm going over 1 hour. I'm sorry, because I actually have a lot of information. There's no way to finish in 1 hour. So this is the part that I threw in that's different from what you will see. And the reason is because I'm sort of a Chinese herb nerd and also a pharmacology nerd, so I need to know both how they work from a TCM perspective and also from a Western medicine perspective. So to me, that would then help to paint the whole big picture. All right, so let me show you some information regarding both the research that's available from both single herb and also herbal formula perspectives. All right, so hopefully for those of you who are also Western science minded, this will help to make a lot of sense. Or in fact, actually, in the last few weeks or so, we actually talked to quite a few medical doctors and also some hospitals who are interested in exploring Chinese herbs. So if you do talk to Western trained practitioner, this is what they listen to and this is what they understand. So let me quickly describe the pharmacology of some of the single herbs as well as formulas. So these are the ones we'll go into. Huangqi, as we mentioned, astragalus, is mostly an herb that tonifies qi, raise yang, but our main use here is to tonify away qi or the defensive qi, much as in the formula, Yu Ping Feng San, the jade windscreen powder. And obviously, in addition to tonify the Wei Qi that we know, this is one of the best herbs to stimulate the immune system. It has been shown to promote the generation of T cells and also to activate the B cells. Okay, so what that means is T cell is your non-specific immunity and B cell is your specific immunity. So not only will if you take this herb, not only will it help with macrophage to just gobble up and destroy any of the foreign substance without knowing what it is, it will also help to activate B cells that will specifically identify the virus, destroy it, and then also remember what it is. So this is basically how you develop the antibodies. So use of Huangqi will help to stimulate the immune system to do both. So it's good for both the short term. It's also significantly important for the long term. Okay. Next herb we talked about quite a bit also is Jinlin Hua, Lanesra flower, which is the main ingredient in the formula in Chao San. So like pretty much all of you know already, this is a great formula for treating wind heat, the early stage of all types of common cold and influenza. So TCM description is to clear heat and eliminate toxins. But guess what? There are so many herbs that have these descriptions. When do we use which herb? Okay, we really don't know. So if you go a little bit deeper, then what happens is this herb is a great antibacterial and also great antiviral herb. I would say antibacterial is good, but not as good as Huanglian, Coptis, or Huangqin's Cutaria type of herb. So this herb really is a much better antiviral herb. The compounds in this herb have been found to be effective against many different types of virus, including influenza, Coxsackie virus, including many others. And specifically, it has also been shown to inhibit the SARS-CoV, so that's a SARS coronavirus replication at a non-toxic concentration. And the reason it says non-toxic concentration is because in this particular study, they looked at quite a few herbs. And Huanglian Coptis also has great effect to inhibit SARS-CoV, but it requires injection in order to get enough into the body. Okay, so in that case, it's not an ideal candidate because if you do it by mouth in decoction or powder, you really need a lot, and then that might create a lot of side effects. All right, so Jininhua is a better choice, like I mentioned, because it's a better antiviral herb, specifically also effective against SARS-CoV. Banlangen, Isatus root, and also Daqingye, Isatus leaf, like I mentioned, are also a pair of excellent herbs that clear heat and eliminate toxins. Classic formula did not use these two herbs too much, but I think they play a great role to treat various types of infections today. Some of their most useful functions are number one, antibacterial, antiviral, and also these herbs, Daqingye and Banlangen, have excellent antitoxin function. And what that means is sometimes it's not enough to just treat the bacteria or treat the virus, because what happens is even if you treat the bacteria or the virus, the lipopolysaccharides from the bacterial cell wall or bits and pieces from the viral shedding will trigger severe inflammation. Okay, so that's basically a cytokine storm and lead to significant inflammation. So even if you kill the bacteria and kill the virus, that overreaction and inflammation is still possible. So the term antitoxin, okay, means these herbs will help to stop those progressions. So Banlangen in this case is also a good antibacterial, but probably even better as antiviral and also help as antitoxin. All right, so it is effective against various types of influenza virus, avian virus, swine originating virus, Japanese encephalitis virus, adenovirus, herpes virus, and so on and so forth. All right, and also specifically, Banlangen shows direct effect to inhibit the enzyme activity of SARS coronavirus. Okay, then Xi Xin Huttonania. Okay, this is an herb we also see quite a bit in all the formulas from the earlier examples. So historically, they clear heat and eliminate toxins and drain pus. So once again, there are many herbs that clear heat and elimination. So this is why I like to study the pharmacology of herbs. It helps to take a big basket of herbs that clear heat and eliminate toxins and help to narrow down exactly what is a best herb to use. So Xi Xin has great antibacterial and antiviral effect. Virus-wise, it's good against herpes simplex virus, acyclovir, which is Zovirac, resistant herpes simplex virus, H1N1 influenza virus, pseudovirus, influenza virus, and also HIV. And then specifically, the water extract of Xi Xin also has antiviral effect to treat coronavirus in SARS. Xi Xin exhibits significant inhibitory effect on the virus and increase the proliferation of lymphocytes in a dose-dependent manner. So not only does it suppress or inhibit SARS virus, it also increases your lymphocytes. All right. The next herb is actually one of the best herbs, but an herb that we probably never study in school and probably have never used. And it's also never in any other classic formulas to my knowledge. So once again, generic term is that Xiangchunye Tuna sinensis clears heat and eliminate toxins to treat lung heat and lung cough. Okay, also clears heat and eliminate toxin from the skin to treat sores and abscess. So once again, if you see that description, you probably go right past it. You wouldn't even think about using it for SARS. And what they have found is that Xiangchunye contains a compound called TSL1, and that's simply Tuna sinensis leaf extract, okay, that selectively bind to the SARS-CoV virus to inhibit the cellular entry of the virus into the host cell. It also inhibits the replication of the coronavirus to treat SARS. All right, so not only does this herb inhibit the replication of the coronavirus, it also inhibits the virus from going into the host cells. All right, so at the conclusion of this study, the researcher described that of all the herbs they have tested from Sanghan Lun, discussion of cold-induced disorder, and also Wenbing Lun, the worm disease, this is a single most effective herb to treat SARS coronavirus. All right, and then lastly, an herb you probably will never have think about using for infection and inflammation. Wubeizi is Gala chinensis. This is basically an astringent herb, right? In Chinese medicine, we use astringent herb to bind, to retain, to stabilize. So we're generally using it for a weak deficiency situation. The TCM theory tells us that if you use a stringent herb in somebody who have a heat or damp heat type of situation, you probably lock in the pathogen and then make the condition worse. And so from that rationale perspective, nobody would really use a stringent herb to treat a infection or inflammation condition. However, 五倍子高拉全ensis has actually been shown to have good antiviral effect, okay, against Epstein-Barr virus, against HIV virus, okay, and so on. And then more specifically, it contains a compound called tetra-O-galliol beta-D glucose, okay, and luteolin. And they have been shown that these are the compounds that have prominent anti-SARS virus activity. And how they work is they bound to the surface spikes or the protein of SARS virus, and therefore interfere with the entry of the virus into the whole cell, right? So we have all seen a picture of the coronavirus. It's a virus with a lot of protein sticks out from the surface. So what happens is those spikes are what attaches to the lung receptor and then goes into the whole cells. So this herb, as a binding herb, a stringent herb, actually, interestingly, bind to the spikes of the coronavirus. And once the spikes are occupied, they can no longer enter the whole cells. Okay, so I think that's very fascinating. Okay, so like we mentioned, this is a novel coronavirus, right? So we are going to find a lot of information in the future. And these are some of the things that I think are quite interesting. And I think not just for academic purpose, but I think may also have a lot of clinical values, all right? So those are the research as far as single herb goes. This one here is a research for herbal formulas. This is a study on 玉屏风散, J windscreen powder. And this is from a study done in Hong Kong and published in the Journal of Alternative and Complementary Medicine. The title is The Use of an Herbal Formula by Hospital Care Workers During the SARS Epidemic in Hong Kong to Prevent SARS Transmission, Relieve Influenza-Related Symptoms, and Improve Quality of Life. And basically, the gist of the study is they have recruited 16,437 hospital workers, including doctors, nurses, and others in this hospital. And they voluntarily go into two groups. 1,064 go into the herb group, and 15,374 go into the non-herb group. All right, and this is the herbal formula they use. And once again, if you look at the first three herbs, what formula is it? 玉屏风散, right? So basically, 玉屏风散is a primary formula, and Sangjuyin, mulberry leaf, and chrysanthemum decoction is used to help to treat the mild fever or early stage of heat. And then they added two herbs. One is 大青叶 isatus. So once again, like we mentioned, 板蓝根 and 大青叶 isatus root and leaf are great herbs to treat bacterial infection, viral infection, even work against coronavirus, and also have antitoxin effect. And also Huangqin scutularia, a great herb to treat heat in the upper jiao, so great for lung infection. So this is a formula that they chose, and they asked all the volunteers to take the herbs for 2 weeks. And what they found at the end of the 2 weeks is that of 1,063 patients in the herb group, 0 were infected with SARS. Of the 15,375 in the non-herb group, 64 were infected, so 0.4%. P-value is 0.035. And what that means is we can say with 95% confidence that the herb helped to prevent the SARS infection. Okay, and so that's the effect. The downside is among the 1,063 that took herbs, 19 show, or 1.8% show minor side effects, including diarrhea, sore throat, dizziness, and nausea. All right. So from a Western medicine perspective, right, they're always talking about research. Well, here's the research. From a benefit and risk evaluation perspective, benefit is you have 95% confidence that the herbs were to prevent the infection. And the risk is 1.8% ended up with mild side effects. So definitely you have very strong confidence. You have very good benefit. and you have very minor, and I would say in most cases, very manageable or negligible side effects. All right. So as far as I'm concerned, if I work in a hospital, or even today, if you just go about your daily life, you may be exposed to SARS coronavirus. There should be no reason why anyone would not take the herbs. I think there's far more benefit than risk. There is significant confidence that the herb work very well. Okay, so I would say overall there are probably two reasons perhaps you can argue against this particular study. One is this is against the SARS coronavirus. Okay, the COVID is a novel coronavirus, so SARS-CoV-2. It's not exactly the same virus, so perhaps what works against SARS-CoV may or may not work against SARS-CoV-2. Okay, so we don't know that, so we can make that argument. But once again, if you take the herb and it doesn't work, what do you have to lose? Okay. The other is if the patient is going to take immune boosting herb, whether it's Huangqi, astragalus, or Yuping Fengshan, then make sure they don't have pre-existing conditions such as autoimmune disease, because if they have autoimmune disease and they take herbs that boost the immune system, there is a higher chance that they may end up with a flare-up of their autoimmune condition. And number two is if the patient has an organ transplant and they are taking immunosuppressant drugs, then I would say it's probably not worth the risk, okay? Because if you use the herb that boosts the immune system, if somehow that negates the effect of immunosuppressants and they end up with organ rejection, that's probably just as bad as catching the COVID, all right? So my recommendation is not to use herbs, Huangqi or Yuping Fengshan, if the patient have either autoimmune disease or are taking immunosuppressant drugs. All right, this is another study from Beijing, basically similar idea. 3,561 staff in hospital, 163 in another hospital, two separate studies. The idea is they use Yuping Fengshan plus some heat clearing and detoxifying herbs. So most likely in Chaoshan type of formulas for 12 to 25 days, or 6 days and 12 to 25 days, and zero infection among all the participants. Okay, this one I didn't like it quite as much from a study perspective because they don't have a comparison between people that took herbs versus people that they did not take herbs. So it's harder to draw conclusion from this particular study. All right, so as we come near the finishing line, okay, let me share with you something else that I think is quite important. This is a picture of Dr. Wu Youxing from the 1580s to 1600s. He is the very first person that started the thought of Wenbing, which is a warm febrile disease. So he is the first one that described that these patients that have these warm epidemics, what happened is these are not heat or cold or damp or the weather patterns. These are something else. These are something that we cannot see with our naked eyes. But they transmit from one person to another via heaven or earth. So he is basically describing the air transmission and the physical contact type of transmission. All right. So he is the one that started this entire Wenbing theory. All right. So that's why today we have Sanghan, cold-induced disorder, and also Wenbing, warm febrile disorders. And when you put both together, it in a way brings the yin and yang together and give us a much better complete picture on how to best treat these type of epidemic disorders. This is another one of my favorite slides. This is a booklet called The Sanford's Guide to Antimicrobial Therapy. And I saw this on my first day at USC, School of Pharmacy. And when I saw it, I got really excited because this is what pharmacists call the Bible for infectious disease specialists. And the reason is because the proper guidelines or the most updated guideline for what antibiotic to use for what infection changes rapidly. And the reason is because microorganisms also mutate very quickly and they become resistant to drug. Anyway, to make a long story short, the two Chinese characters on here are called Ze Bing. And if you were to flip to the inside front cover, what it says is Ze Bing, heart diseases. They gave credit to Huangdi Neijing, Yellow Emperor's Inner Classic from the 1st or 2nd century, that the heart disease that we know that the Chinese TCM knows in the past is most likely the infectious disease that we see today. And that a lot of the bitter and cold herbs that clear heat and eliminate toxins, in fact, have excellent antibacterial, antiviral, antifungal, antiparasitic type of effects. All right. So this, in a way, is a great example of integrated medicine to bring both sides together, to utilize, keep an open mind, and treat the patient with whatever that works. All right. So now the question is, where do we go from here? COVID-19 is obviously something that has affected the whole world, and it's starting to get worse, and it's going to get worse before it gets better. All right, so where do we go from here? And I think the first and most important thing is we need to work together. And by that, I mean the patients, the TCM practitioner, and also the Western practitioners, because I think we all play a role. Obviously, the patient need to do their part, and that is to follow the CDC, WHO type of recommendations. Stay home if they need to, if they show signs and symptoms, keep a safe distance, all those type of things, okay? And then Western medicine is excellent in crisis management. They are excellent in diagnostic tools, right? So they play the very important role to diagnose patients and see whether they have COVID-19 or not. And then if they do, then obviously you need to take whatever precaution you need to take. Western medicine is also excellent in terms of crisis management. So if they start to have significant pneumonia, ARDS, sepsis, and so on, I think Western medicine is a better option, especially if they need ventilator, if they need ECMOs. Okay, but what happened is at this point in time, there's really no cure. Okay, whatever drug that they're giving for COVID-19 treatment, all the drugs are still experimental or they are supportive in nature. Okay, so this is an area where Chinese medicine, like I mentioned, have over 2,000 years of experience. And also, COVID-19 started out in China, and they have treated many more patients than the rest of the world. So in fact, a lot of the doctors from China are now going to other countries to help they cope with COVID-19. And the best example is Italy. A lot of the doctors from China are going to Italy to help with the doctors over there on how to address this crisis. All right, so there are a lot of things that Chinese medicine can offer. And my personal opinion is TCM is probably best utilized in the very beginning and also at the very end. Okay, in the very beginning with prevention. And like I mentioned, with that article in Hong Kong, you had 95% confidence that the herbs will work well to prevent the SARS infection. It's not SARS-CoV-2, but I think this is the best option that we have at this point in time, right? So we really have nothing to lose. And if the Western doctors need a study to be convinced or to understand, we have a perfect study to show them, okay? Herbs will also, I think, work very well in the early influenza phase, at least until they are confirmed. So when they come in with generic signs and symptoms, what I would do is I would give them the herb and make sure they go get tested. And once again, if they end up with common cold or influenza, that's fine. They can just treat themselves, or you can treat them. But if they end up with COVID-19 being positive, then perhaps they need to follow the Western medicine protocol. Obviously, quarantine, stay at home. If they need to be hospitalized, obviously be hospitalized. If they are in fact COVID-19 patients, then I don't know if it's a good idea for acupuncturists in the US to treat these patients, because if you do, then you're risking your health, you're risking other patients that go to your clinic, and I think in most cases we're not prepared to treat these patients. Western hospitals barely have enough masks and gloves and gowns. I don't know if you want to be wearing all that to do acupuncture for the patients, all right? But I'll leave it out there. Personally, I don't think it's a good idea because I don't think we are ready for that, okay? But I think we are ready for the prevention phase. I think TCM is a great tool for the early phase. Maybe not the pneumonia part, maybe not the sepsis or the cytokine storm part, but eventually the patients are discharged from the hospital and they still have lung problems. Once again, I think that's a great area for TCM to help them to heal and recover. All right, so that's why I mentioned everybody plays a part. Patient need to play their part. TCM and Western medicine each have their pros and cons, their strength and their weakness. All right, so if we can work together, I think that that's the best way for us to get through this crisis together. All right. And what I have also done is I have put together a lot of the links that I think are most useful. So this is for my last about 2 months or so of all the research putting things together. So these are the links for WHO, NIH, CDC, and FDA. These are links for Western medicine science informations from Elsevier, Johns Hopkins, New England Journal of Medicine, JAMA, and so on. And these are the references from TCM perspective. So a lot of the information that I mentioned today, you can go to the Lotus website, and we have a resource center for the coronavirus, and you can download all the information, including the latest, the 7th edition of Guidance for COVID-19 in Chinese, and also in English, as well as the acupuncture protocol that we mentioned. Okay, so all the information is there. And then lastly, if you have any questions at all, feel free to send me an email. This is my personal email address. Feel free to send me an email. I'm sure I'm going to get bombarded with a lot of emails, but I will get back to you. Maybe I'll try to get back to you definitely within 24 hours or so. All right. And that's it for today's seminar. I know I obviously went over time, and I tried to speak fast, but hopefully not too fast. I believe today's class is also recorded. Okay, so we should have it available by the end of the day or sometime early tomorrow. Donna is here? Yeah. Okay, so Donna is going to take over, okay, and she's going to wrap up the class for us. Thank you very much.